Good morning to respected teachers. Today I am going to present my journal club on the topic of clean air in cancer control and overview of the evidence. Now coming to the introduction. According to the WHO, 99% of global population lives in area where air population exceeds recommended air quality guidelines. Air pollution is recognized by WHO as the largest environmental risk factor for disease, with impacts comparable to tobacco use, malnutrition, and obesity. Exposure to air pollution is linked to numerous health conditions, including respiratory disease like asthma, COPD, lower respiratory tract infection, ischemic heart disease and stroke, diabetes, eye disorder, dementia, and adverse neonatal health outcomes like low birth weight in preterm birth. The link between air pollution and lung cancer is well established. The International Agency for Research on Cancer classified household air pollution burning from solid fuels such as wood, coal, charcoal, dungs as a Group 2A carcinogen since 2006 and outdoor air pollution as a Group 1 carcinogen since 2013. Recognition of air pollution as a major health risk has driven stronger policies and action reflected in key reports such as WHO Report on Cancer 2020, IARC World Cancer Report 2020, EU Beating Cancer Plan, and European and Latin American Caribbean Codes Against Cancer. Recent estimates from IARC indicates that air pollution is responsible for 4,34,000 plus lung cancer globally, in which 27.5% of preventable lung cancer in women and 15.8% in men. The global burden of disease in 2021 estimates that nearly 18.6% of lung cancer deaths linked to particulate matter 2.5 exposure, and the highest burden of air pollution related cancer deaths occur in South Asia, Africa, and Eastern Mediterranean. Effective policies such as enforced emission standard, integrating exposure reduction measures into the urban planning, and expanding clear energy solution can quickly and cost effectively reduce population exposure. Emerging evidence suggests that air pollution may contribute to cancers beyond lung cancer, highlighting the need for strong public health action. Now, air pollution is a mixture of harmful solid particles and gases in the air that can negatively affect human health, and that are of two types: outdoor air pollution and indoor air pollution. Outdoor air pollution major source includes transportation, industrial activities, agriculture, waste management, and energy generation. And indoor air pollution mainly caused by household fuel combustion for cooking and heating. Common solid fuels include wood, coal, dung, and crop waste. Major air pollutants, particulate matter. Particulate matter are tiny solid particles and liquid droplets suspended in air, example dust, soot, and smoke, and widely used as an indicator of overall air pollution. And it is classified by the according to the size of particle. PM10 means diameter is less than equals to 10 micrometer, and particulate matter 2.5 means diameter of particle is less than equals to 2.5 micrometer. Major components include sulfate, nitrate, ammonia, black carbon, mineral dust, sodium chloride, and water. Ground level ozone is a major component of photochemical smog, and it is formed with when nitrogen oxide and volatile organic compound react in presence of sunlight, and main sources are vehicle emission and industrial activities. Nitrogen oxide emitted from motor vehicle, construction and agriculture machineries, factories, fossil fuel based power plants, and sulfur dioxide released during the burning of coal and oil and smelting of sulfur containing mineral ores. Now coming to the methodology. This report was developed using a rapid evidence synthesis approach, and the authors reviewed available systemic review to synthesize the literature across the different type of air pollutants and cancer type. And the in inclusion criteria, they included systematic review that reported data on association between air pollution and risk of developing cancer and the risk of cancer mortality. To identify these studies, the authors searched 5 major electronic databases from PubMed, Embassy, Classic Embassy, Cochrane Database of Systematic Review, Green File, and Singh. A cascade screening approach was used to manage the large volume of literature, and the full text of systematic review was then assessed for inclusion. And the articles which didn't report data on association between air pollution and risk of developing cancer were excluded from the study. If there were multiple estimates from the same year on the topic, then researchers reviewed both and made a selection. Only single estimates were extracted for a particular air pollutant cancer site. Findings from the included review were synthesized by using a structured narrative synthesis approach and classified into the two subsections. First is risk of developing cancer and second is risk of dying from cancer. Within each category, results were further grouped according to the type of air pollutants. Now coming to the result. In this study, authors were extracted 248 total articles, in which the 186 were taken from PubMed and 4 from Embase Classic, and 0 is from Cochrane database, and 20 for Greenfile, and 38 from Singh. Out of 248, 40 articles were removed due to the duplication, and total screen were 200. And then finally, out of 200, 118 data were excluded on the basis of title and abstract, and 49 excluded on cascade screening, and finally the 41 articles were included for systematic review and included in this study. Now limitations. Evidence mainly based on observational studies, cohort and case control, which are prone to confounding factor. Example is smoking, socioeconomic status, occupational exposure. Variation in exposure assessment method often relying on indifferent measure. Example, residential location instead of individual monitoring. Lack of detailed data on exposure duration, intensity, latency, and site-specific cancer outcomes. A small sample size in studies on rare cancer leading to limited statistical power. Majority of studies conducted in high-income countries show limited global generalizability. Systematic review meta-analysis may be affected by publication bias and selective reporting. Evidence is strongest for lung cancer but limited for other cancer types due to the fewer studies. Now, air pollution is a cancer risk factor. Air pollution is a well-established cancer risk factor. Emerging evidence from systematic review suggests association with additional cancer sites. This summary synthesizes current finding on general exposure to outdoor air pollution, particulate matter, non-particulate air pollutants and chemical compound, and to indoor air pollutants. Exposure to outdoor air pollutions. The higher level of the ambient air pollution associated with increased risk of cancer overall. Individuals exposed to higher pollution levels showed 4% increase in overall cancer risk, and cancer risk increased in both the sexes. Men has 7% higher risk and women has 4% higher risk. Strong evidence links ambient air pollution to lung cancer with a 4.9% increase in risk. Emerging evidence suggests association with ovarian cancer and cervical cancer. Risk of germ cell tumor, a type of ovarian cancer, was 1.16 times higher among those with greater pollution exposure. No statistical significant association was found for breast and urinary bladder cancer. In children, higher exposure to traffic-related air pollution was associated with 1.05 times higher odds of acute lymphoblastic leukemia. Particulate matter 2.5 and 10, particulate matter 10 and cancer risk. PM 2.5 is recognized as a major air pollution related predictor of cancer risk, and every 10 microgram per meter cube increase in PM 2.5 was associated with 11% higher incidence of all cancer, 8% higher risk of lung cancer, 63% for brain cancer, 32% of liver cancer, 18% of colorectal cancer. Every 5 microgram per meter cube increase in PM 2.5 was associated with 9% higher risk of kidney cancer and 7% of bladder cancer. Most studies reported a positive association between PM 2.5 exposure and ovarian cancer risk. Every 10 microgram per meter cube increase in PM10 was associated with 10% higher risk of all cancer, 29% for kidney cancer, 14% for prostate cancer. No statistical significance was found between the PM10 exposure and breast or brain cancer. Now, non-particulate air pollutants, nitrogen dioxide, a major traffic-related pollutant, was associated with increased cancer risk. For every 10 microgram per meter cube increase in nitrogen dioxide concentration has 3% higher risk for lung cancer, 10% for kidney, and 1.5% for breast cancer. Emerging evidence suggests possible link between the nitrogen dioxide exposure and ovarian cancer and cervical cancer. Every 10 microgram per meter cube increase in black carbon exposure was associated with 66% higher risk of brain tumor, 142% higher risk of malignant brain tumor, and exposure to high level of polyaromatic hydrocarbon and benzopyrene was associated with 12% increase in overall cancer risk. Now, indoor air pollution. Indoor air pollution is associated with substantially increased cancer risk and is recognized in both European and Latin American and Caribbean cancer prevention codes. Exposure to household air pollution was associated with 69% higher risk of lung cancer, 201% higher risk of esophageal squamous cell carcinoma. Women exposed to cooking fumes and solid fuels showed a consistently elevated risk of cervical cancer. The burden of indoor air pollution disproportionately affects women, lower economic group, and population in low and middle income countries. Use of solid fuels for cooking and heating is a major contributor to household air pollution, and current evidence highlights the need for further research on indoor air pollution and cancer and targeted policies and interventions distinct from those addressing outdoor air pollution. Now these are the table which shows the percentage of occurrence of different type of cancer, which I have already explained in previous slide. Now, air pollution and cancer risk in marginalized population. The health impacts of air pollution are not distributed equally. Children, older adults, and lower socioeconomic groups are disproportionately affected. Children are more vulnerable to air pollution due to their stage of physical and cognitive development. Lower income population are more likely to live in highly polluted area, experience greater occupational exposure to pollutants. Living near petrol station within 5 kilometers, one study reported an odds ratio of 0.95 indicates no significant increase in overall childhood cancer risk compared with children living farther away. However, children living near petroleum facilities had a 90% higher risk of childhood leukemia. Living near cement factories, emerging evidence suggests a significantly higher risk of several cancer among nearby residents. Adults living within 3 kilometers had 4.8 times higher odds of developing lung cancer, and children living within 2.5 kilometers had 3.9 times higher risk of malignant bone cancer and 32% increased risk of death from leukemia. And general population living within 5 kilometers had 4% higher all cancer mortality, 9% increased risk of colorectal cancer mortality, and 59% pleural cancer mortality, 11% bladder cancer mortality, and 61% increased risk of peritoneal cancer mortality in men. Now, these are the tables. Air pollution as a risk factor for cancer mortality. Research on air pollution and cancer mortality has increased substantially in recent years. Improvement in air quality and cancer mortality data have enabled more detailed investigation of this relationship. This evidence indicates that exposure to polluted air can increase the risk of death from several cancer types across both outdoor and indoor air pollution exposure. Research findings cover exposure to outdoor air pollution, particulate matter, and to other specific pollutants, and indoor air pollution. Outdoor air pollution and cancer mortality. Exposure to higher level of ambient air pollution associated with 8% increase in risk of death from all cancer types. Men has 7% increased risk and women 8%. The strongest association between general ambient air pollution and cancer mortality risk was observed in lung cancer, with a lung cancer mortality 10% and breast cancer mortality 14%. Consistently elevated risk of ovarian cancer mortality linked to higher level of air pollution exposure, including particulate matter 2.5 and 10 were reported, but it is not currently possible to provide a full estimate. Particulate matter 2.5 and 10 and cancer mortality per 10 microgram per meter cube increase in PM 2.5 following increase in cancer mortality. All cancer 12% and lung cancer shows 11.8% mortality, colorectal 21%, breast cancer 20%, liver cancer 14%, and per 10 microgram per meter cube increase in PM10 increase in cancer mortality risk included lung cancer 13%, kidney cancer 52%, and breast cancer shows 11% mortality. Non-particulate air pollutant and cancer mortality per 10 microgram per meter cube increase in pollutant. The following increase in lung cancer mortality risk were observed: nitrogen dioxide 7%, nitrogen oxide 6%, black carbon 5%, sulfur dioxide 2%. Evidence across other cancer types is limited, with most available data focused on lung cancer mortality. Indoor air pollution and cancer mortality. Evidence on household air pollution and cancer mortality is very limited. Only one review reported a 6% increase in cancer mortality risk, but this was not statistically significant. Fewer studies are available due to the reduced exposure in some high and middle income countries due to policy action. Higher exposure persisting in low income countries with limited monitoring and research coverage. As a result, there is lack of sufficient data to fully assess the impact on cancer mortality. Occupational air pollution, exposure, and cancer risk. Occupational exposure was not the primary focus of the report because workplace risks are already well studied and regulated. 14 systematic reviews evaluated occupational air pollution as a cancer risk factor. Now, diesel exhaust cause increase 1.3% lung cancer, 13% head and neck cancer, 13% laryngeal, and 41% cervical cancer. Welding fumes cause 89% increase lung cancer, 20% genitourinary cancer, 28% kidney cancer, and wood dust cause 41% increase small cell lung, 1.56 higher odds of leukemia, and 1.5 higher odds of nasopharyngeal. Coal mine dust causes increase 41% small cell lung, 1.56 leukemia, and 1.5 into higher odds for nasopharyngeal. Conclusion. Air pollution is a major risk factor for cancer with the strongest evidence for lung cancer. Increasing evidence links air pollution to breast, cervical, colorectal, liver, kidney, brain cancer. Particulate matter 2.5 and 10 is the most harmful pollutant. PM 2.5 increase 11% risk of overall cancer associated with lung, liver, and colorectal cancer, and PM 10 associated with prostate and kidney cancer. Air pollution also increases cancer mortality. 12% higher overall cancer mortality with increased death from lung, breast, colorectal, liver, and kidney cancer. Low socio-economic population experience greater exposure to air pollution and therefore face higher cancer risk. Public health policies and pollution control measures are essential to reduce exposure and lower the cancer burden. Thank you.